So here, regarding the assessing, how we assess risk factors, obesity assessment for risk factor. Existing disease, which is established coronary artery disease, diabetes type 2, sleep apnea. This is, let's say, from obesity. From other obesity, this could give you osteoarthritis, gallstones, gallbladder disease. Cardiovascular disease, as we mentioned, mostly it's related to high blood pressures, secondary to obesity. Other risk is increasing the blood cholesterol and decreasing the physical activity. Controlling obesity can reduce medical cost. This slide is really important for us here in Saudi Arabia. Some studies done in 2010 showed that the government here in Saudi Arabia, they spend around 20 million to prevent car accident and traumas. And how many, like the mortality rate of car accident and trauma in Saudi Arabia? In some studies, we got it from here in Saudi Arabia, we found that it's around, like, let's say 7,000 per year. Other studies found that the mortality rate of obesity is around 20,000 per year. So if you compare the car accident to obesity mortality rate, you found that here is around 7,000 per year for a car accident, and for obesity you'll find that it's around 20,000. How much they paid? They paid around 20 million for the car accident, and how much they paid for the prevention of obesity? Nothing, zero. So I think we should deal with obesity as a disease, and we should start a preventive measurement and strategies to help us to decrease that mortality rate. If you look what they did in the state and how they treat that, they found that a total direct and indirect cost of obesity in the United States is estimated to be at least 99.2 billion. That's in 1995. If you remember from my slide, 1995, it's around, let's say that the obesity is not that much. It's not reaching even 20%. But they did a good, actually, prevention measures, and they spend money to trying to prevent the obesity. From that study, they found that direct cost, it's 5.7%, and cost due to obesity-associated disease like heart disease, diabetes, and osteoarthritis. That's mean direct cost. Sorry, it's not clear for you, but let me explain it. 99.2 billion. Direct cost is around 5.7 from 99.2. And cost due to obesity-associated disease is around, let's say, it's around like 82% of 99.2 billions. 6% to 10% weight loss reduce a treatment cost. So if the patient is obese and he's reducing his weight by 6 or at least 10%, they found that the cost is decreasing per patient, per day, per month by $123. And for the hyperlipidemia patient, that's for insulin treating diabetes patient, and for hyperlipidemia patients, it's around $61 per patient per day per month. And for patient on oral hypoglycemic medication, it's around $43 per day per month per patient. So the end result of that is, I think we should start assessing our cost, how much we spend for cardiovascular disease, how much we spend for diabetes, and I think we should start doing some prevention strategy to help us to decrease the rate of obesity in our kingdom. Health benefit of weight loss. if patients start to decrease his weight, or if we start to help him to decrease his weight, this will lead to decreased coronary artery disease risk, decreased MI rate, decreased stroke rate, improve serum lipids, and also it will improve the insulin sensitivity and resistance, and this will lead to also decreasing the symptoms of osteoarthritis and decreasing the rate of asthma and sleep apnea.